In this procedure, you will learn how to instruct the patient in collecting a contaminant-free urine sample for culture or analysis using the Clean Catch Midstream Specimen, or CCMS, technique. Greet the patient and identify yourself.
Hi, Peggy. How you doing?
Good.
Good. I'm Tori. I'm Dr. Smith's medical assistant. I'm going to ask you a few questions before we get started, okay?
Verify the patient's identity with full name and date of birth.
Can you please give me your full name and your date of birth?
Peggy O'Brien.
Explain the procedure in a way the patient will understand. Answer any questions the patient may have. Show the patient the sterile, sealed container and explain how to open and lay the lid on the counter face up. Then, explain the following instructions to adult patients or to the guardians of pediatric patients, making sure you show sensitivity to privacy issues.
Peggy, Dr. Smith would like for you to give us a urine sample. I'm going to go through a Clean Catch Midstream with you. Have you done that before?
Yes.
Yes. Okay. So I'm going to give you my instructions. And then
Okay.
So I want you to make sure that you wash your hands well with soap. Then you're going to rinse and dry them. Once you're done with that, you're going to go ahead and unscrew the top of this, and you're going to place it face down like this. Make sure that you do not touch the inside so that you don't contaminate the cap. Once you're done with that, you're going to go into the toilet, cleanse yourself with the towelettes.
Expose the urinary meatus by spreading apart the labia with one hand. Using 2 separate antiseptic wipes, cleanse each side of the urinary meatus with a front-to-back motion, from the pubis toward the anus. Using a 3rd antiseptic wipe, cleanse directly across the meatus, front to back. To flush the urethra, void a small amount of urine into the toilet. Move the specimen container into position and void the next portion of urine into it. Fill the container halfway. Remember, this is a sterile container. Do not put your fingers on the inside of the container.
And then you can go ahead and flush. After that, you want to go ahead and put the cap back on. Make sure you don't touch the inside of the container nor the cap, and close that up. Then you can go ahead and come back into the room.
For a male patient, give him the following instructions. Sanitize your hands and open the towelette packages for easy access. Expose the penis, and if not circumcised, retract the foreskin. Cleanse the area around the glans penis, the tip of the penis, and the urethral opening, or meatus, using a separate antiseptic wipe on each side. Cleanse directly across the urethral opening using a 3rd antiseptic wipe. Void a small amount of urine into the toilet or urinal. Collect the next portion of urine in the sterile container, filling the container halfway without touching the inside of the container with the hands or the penis. Void the last of the urine into the toilet or urinal. Place the lid on the container, taking care not to touch the inferior surface of the lid. Wipe, wash your hands, and redress. Return the specimen to the designated area. Before processing a Clean Catch urine specimen, document the date, time, and collection type of the specimen. Wash or sanitize your hands. Put on a fluid impermeable lab coat, protective eyewear, and gloves. Process the specimen according to the provider's orders. Perform urinalysis in the office or prepare the specimen for transport to the laboratory. If it is to be sent to an outside laboratory, make sure the label is properly completed with the patient's information and the date, time, test ordered, and your initials. Place the specimen in a biohazard specimen bag. Complete a laboratory requisition and place it in the outside pocket of the specimen bag. Remove your gloves and dispose of them appropriately. Keep the specimen refrigerated until pickup. Remove your protective eyewear and lab coat. Wash your hands or use hand sanitizer. Document that the specimen was sent.